Hello, hi Mrs. Cheswick, how are you? How you doing today? I'm CNA Evelyn, how are you? Can I look at your armband? I have to perform some care for you. I just want to make sure I have the right person. Oh yes, Mrs. Cheswick. What's your birthday? 11/8/54. Okay, very good, Miss Cheswick. Okay, what I'm going to be doing today is we're going to be doing some perennial care. We're going to wash your privates front and back. The door is shut. I'm going to shut the privacy curtain now. Okay, privacy curtain is shut. I'm making sure that the bed is down in the lowest safe position and that the wheels are locked. Checking the wheel locks on the bed. They are locked. Her bed is flat. Okay, Miss Cheswick, I have to wash my hands and gather some supplies, okay? So I've washed hands. Miss Cheswick has her coal light. I want to get a linen protector to put on my table to create a sterile barrier on my overbed table. I'm going to get another linen protector, 6 washcloths, and a pair of latex gloves. I'm also going to get a wash basin and some soap. I'm going to put the rail up on this side of the bed because we're going to be rolling Mrs. Cheswick this way. I don't want Mrs. Cheswick to roll out of bed. Okay, so we have the side rail up. The bed's down, the wheels are locked, bed's in the lowest safe position. We have privacy. I've explained the task to her and I've identified her, making sure she's the right patient, the right care for the right patient. Okay? So I'm going to get some water in my basin now. Alright. I got water in my basin. I'm going to check the temperature. It should be about 105 degrees. Not too hot, not too cold. I'm going to ask Mrs. Cheswick if she would check it for me as well. I want her to be comfortable. Thank you, Mrs. Cheswick. So I'm going to set my water down on my overbed table. And I'm going to re-sanitize my hands. Use some hand sanitizer because they're not visibly soiled. Alright, I'm going to put on my latex gloves. Okay, Miss Cheswick, what I'm going to have to do is I'm going to have to expose you from basically your privates. We'll be washing your privates front to back, okay? And I have to take your blankets down a little bit, just enough so we can get the job done. There you go. I'm only exposing her up to the hip with her gown, okay? And the blanket is just above the knee. Okay, what I'm going to do is I'm getting a bed protector, a linen protector, and we're going to put it underneath Mrs. Cheswick. I'm going to roll it up, get it ready. I'm going to lay it on the bed. I'm going to move her gown out of the way, making sure her gown's not underneath her. Okay, Mrs. Cheswick, I'm going to carefully roll you over on your side. If you would for me, could you help me roll you over? And you can hold on to the bed rail on that side, okay? Ready? 1, 2, 3. Okay. So I'm holding Mrs. Cheswick. She's holding on too. I'm rolling out the linen protector. Getting it as far underneath her as possible. Then I'm rolling her back on this side, carefully, easily. I'm going to roll it toward me a little. She's not going to fall off the bed because I'm blocking it with my body. Okay? Straighten her out a little bit. There you go. Fix her down. I don't want to overexpose her again, like I said. Okay. Now we're going to wash Mrs. Cheswick. We're going to wash you, okay, Miss Cheswick? You're going to feel much better when we get you all cleaned up. We're going to take one of our towels. We're going to put it in the water. We're going to wet it. And bring out all the extra water. We're going to take some of our soap, and we're going to soap it, right? Not too much, enough to get the job done. Maybe just a couple of dime-sized blobs. And we rub it in. Get it rubbed in. I got the wash rag folded in quarters. So I got 4 separate corners I could use. Alright, so first corner, we're going to wash down the labia minora. We're going to go right down the middle, down the labia minora. Then we're going to flip up one corner and wash down the left side of the labia minora. Then the right side of the labia minora. Then we're going to open the lips up on her vagina and wash down the labia majora. We're washing from front to back. I'm going to put this in my soiled linens. Then I'm going to get another wash towel and we're going to rinse. Okay, I got the wash towel folded in quarters. So we're going to do the same thing. We're going to right down the middle, labia minora. Fold the corner over, fresh side of the washcloth. We're going to do the left side of the labia minora. We're going to do the right side of the labia minora. I'm going to open up the lips and the vagina, and I'm going to do the labia majora. I'm going to rinse down. We're going to put this in our soiled linens. Then we're going to get a dry washcloth, folded in quarters, and we're going to pat dry. We're going to pat dry right down the middle, being careful not to pull or tug. Then we're going to flip it up, go down the left side, pat dry. Right side, pat dry. Open the lips. Pat dry down the labia majora. Put the wash towel in our soiled linens. Okay, Miss Cheswick, you're looking good. I'm going to need you to roll on your side so we can do your buttocks, okay? Again, you can hold on to the bed rail. I'm going to help you roll over on a count of 3, okay? Ready? 1, 2, 3. That's it. Okay. Now we're going to wet our wash towel. We're going to wring it out, get all the extra water out. Going to put some soap on there. Going to work that soap in. Work that soap in. We're going to do her buttocks the same way, working from front to back. We're going to go up the middle, front to back. Going to do left side, front to back. Right side, front to back. And one more time up the middle, front to back. And we're going to put this in our soiled linen. We're going to get another wash towel. We're going to lube it. We're going to rinse it out. We're going to wet it in our basin. Our basin water is clean. We're putting clean wash towels in clean water. We're not putting soapy wash towels in water, making the water soapy. We're putting the soap on the wash towel after we've already wet it. I'm going to rinse her off. I'm going to wipe down the middle, right up the middle, front to back. Left buttock. Right buttocks. Then we'll go right down the middle one more time. Now we're going to put this right in the soiled linens. Then we get one more wash towel, dry wash towel. We do the same thing on drying. We're going to pat dry now. Going to pat dry, right up the middle. Pat dry left buttocks. Pat dry right buttocks. Pat dry up the middle again. And we put our towel in soiled linens. At this time, I'm going to remove our linen protector because we're done with it. I'm going to throw it away in the trash. This trash is going to go away with me when I leave the room. It's going to go in a special area for infectious materials. It's not just trash like, she would throw trash in a Dixie cup away. Alright, so we're going to roll her back over on her back. Okay, very carefully. Making sure we got proper body alignment. Okay. Now what I'm going to do is I'm going to take my gloves off so I don't infect myself. I'm going to put them in the garbage. And I'm going to I'm going to wash my hands after I take my gloves off. Then I'm going to cover Mrs. Cheswick up. Make Mrs. Cheswick comfortable. I'm going to give her her coal light. Then I'm going to put on a second pair of gloves. I'm going to take my wash basin with the dirty water and I'm going to throw it in the toilet. I'm going to go to the sink and I'm going to rinse the wash basin. I take a towel and I dry the wash basin thoroughly. And I put the wash basin and the soap in the dirty supplies area. And now I'm going to take my barrier off the overbed table. I'm going to throw that away. Okay. Now I'm going to take my gloves off again. And wait till I don't infect myself. I'm going to throw the gloves away in the trash. And then we're going to lower the side rail. Again, we're going to make sure that the bed is in its lowest safe position. We're going to ask Miss Cheswick if she needs anything else. Would you like something else, Miss Cheswick? Here's your call light. If you need me, call me. I'll be right outside. Alright, she's comfortable. She has her call light. I'm going to remove privacy so she can talk to her friends. Miss Cheswick, would you like the door open or closed? You want it open? Okay. Miss Cheswick, do you need anything else? I'll be right outside if you need me. You have your call light, okay? Now I'm going to wash my hands. Washing hands. Okay. Skill complete.